It's 2018, and 10-year-old Nan Yu Wai has a big smile on her face. Why? She has a new kidney. And Dr. Kar Hui Ning from Singapore also has a big smile on her face. Why? She just helped her Myanmar colleagues perform their country's first pediatric kidney transplant. So how did we arrive at this groundbreaking national achievement in kidney care for Myanmar? Well, it all began back in 2015 with an ISN Sister Renal Center trio. It's 2015, and Dr. Kya Thu Ya from Children's Hospital Mandalay and Dr. Yi Kin from Yangon Children's Hospital are seeking ways to address their center's challenges in kidney care. Their two hospitals are the only pediatric renal units existing in Myanmar. They treat a variety of acute and chronic kidney conditions in children, but neither have transplant options for children on chronic renal replacement therapy. They also lack training opportunities for renal nurses who cannot train overseas like the doctors. So they team up with Professor Hui Kim Yap and her institution in Singapore, the Shaw NKF Children's Kidney Center, to become an ISN Sister Renal Center, or SRC, trio. As an SRC trio, our Mandalay and Yangon institutions were able to set measurable training objectives and then pave a learning path of activities with the Singapore Mentoring Institution to achieve those objectives over a period of time. This all supported by the SRC program. Let's jump back to 2018. Our SRC trio has been running for 3 years. And both Myanmar centers have already seen a great improvement in their pediatric nephrology programs. So it's time to address their objective in pediatric transplantation. For this, Yangon is receiving a week-long educational ambassador visit from Dr. Ning, an expert in pediatric dialysis and transplantation from the National University of Singapore. SRCs have priority access to other ISN programs like the Educational Ambassador Program. Dr. Ning and Mentoring Center Officer Professor Yap spend a week providing the local Yangon medical team with the confidence and infrastructure they need to perform the first pediatric renal transplantation. By week's end, the team decides together that they're ready. Nan Yu was diagnosed with juvenile nephrolithiasis and has been constantly in and out of the hospital for the last 24 months receiving chronic hemodialysis, missing school and life in her village. For a chance at a normal life again, her best option would be a kidney transplant. Together, Dr. Ning, Professor Yap, and the Yangon Children's Hospital team prepare for their first transplantation.
So I guess we were a bit nervous, but what was really encouraging was the enthusiasm of the doctors, their motivation, and their wanting this to really work well. And you can see that they were really a very dedicated team.
On January 27, 2018, the first pediatric renal transplant in Myanmar was successfully performed under Dr. Ning and Professor Yap's guidance. The Myanmar team and SRC partners were elated.
My best memory will be that crowded operating theatre at the end of the transplant surgery, with all the doctors and nurses staring into the small screen of the ultrasound machine, trying to assess the flow of the blood vessels in the transplanted kidney. That sense of camaraderie and teamwork among healthcare professionals from both countries was very memorable. My biggest reward was the big smile of the patient 1 week after the transplant, before I left the hospital for the airport to fly home. This patient no longer had to stay in the hospital for years to receive chronic dialysis. She finally could go home to be with her family, and she could go to school.
The major achievement was featured in the local press and caught the attention of Myanmar's Ministry of Health, who pledged to increase resources into pediatric nephrology. Since 2018, more pediatric renal transplants have been performed in Myanmar, both in Yangon and Mandalay Children's Hospitals. The Yangon and Mandalay hospital teams remain close-knit, learning from each other's experiences and reviewing patient management plans together. They remain in touch with their Singapore colleagues via WhatsApp or teleconferencing for advice on difficult decisions.
I must say that the whole team rose up to the occasion and everything went according to plan. And the patient did very well. And when we went back 2 years later, it's such a joy to see that the patient had graduated from high school and was actually going on to university and really doing well too.
And to think, it all started with an ISN SRC trio.